Hello, I'm Dr. TJ Lonergan with the Impact Health and Spine Centers, and I'm sitting here with Dr.
Hal Blatman, Medical Director of the Blatman Health and Wellness Center. And today we're going to talk about, let's say you have a neuropathy. Your fingers are in trouble, your toes are in trouble. What do you do? Is there a way to recover? Are you destined to have that pain, discomfort, numbness, walking on coals for the rest of your life?
You got options. That's a big thing for us to be able to explain to you, is that there's a lot you can do. And we talked a little bit earlier in a prior video about what you can do nutritionally for yourself. There's a lot of options at the grocery store, but beyond that, you want to get more specific, there's more that can be done out there in the healthcare community. And one thing in particular that most people don't know about and they've heard a little bit about is stem cells, Hal.
Stem cells are a very new and an important treatment. If you inject them into the body, they will go to where your body is setting up signal flares where it needs help. And they can latch onto blood vessels nearby and secrete all kinds of growth factors and signals to help your body recover from injury. And there is potential to use that for neuropathy.
And getting that nutrition back into that nerve, that sensitive nerve that's being affected, and that's the reason why you're getting all these altered sensations and it's affecting how you live your life. Beyond just those stem cells, you can also use some supplementation. Talk to us about some specific things in supplementation that really help out.
Nutritional supplements are the ones that we've used for diabetes and diabetic neuropathy for years. They're N-acetylcysteine and alpha-lipoic acid are two of the really big agents that you can use. There's also herbal medicines that can be done. And one of the most fascinating things that helps put energy of healing into the body is infrared light. All kinds of so-called cold laser devices and infrared light devices can help the nervous system recover from an injury.
And when you think of these kind of infrared lights and low-level laser therapy or cold laser therapy, what you're really talking about is these have wavelengths and properties. That's why it's a red light or an infrared. It's on the spectrum. And so these wavelengths and these frequencies signal, again, send up these signal flares you're talking about, like with stem cells.
Right.
Is they stimulate the body to kind of heal itself, right?
And they put energy in the body that the body can use for these healing purposes. And then it's important to eat clean, eat well. We eat for two reasons. We might think we eat because we're hungry. We might think we eat because it tastes good. But that governs what we eat and when. The reason why we eat is two. One is to get fuel to burn, to make energy, and the other is to get raw materials to build new parts. So when your body's trying to repair your nervous system, what's the quality of raw materials you're giving your body to build these new parts is so important.
So that's why we want to keep it simple and clean, because there's enough that the body's got to do. You don't need another activity that it has to do.
Exactly.
And then one thing that we like to do at Impact Health and Spine Centers is we're looking specifically on the nerve signal that's going from the brain down to those toes to make sure everything is actually working correctly. If that signal isn't clean itself, it just makes everything tougher. You're going to need more of that infrared energy.
Exactly.
To get things done. And then, as Hal brought up before, if you're having issues with the fascia or with the muscles in the forearms and the legs, that's also going to affect things. How so, Hal?
Because it's going to kink blood supply, it's going to affect and kink nerves, but it's also going to interrupt blood flow into the muscle, which makes that environment much more toxic as you use those muscles, and you can't wash the exhaust out of the muscle, and that increases the toxicity to the nervous system.
So if we can get that blood flowing a lot better, and we can get the quality of the supplies that are being carried within that blood to be cleaner,
Exactly.
and simpler from your diet, then there's a lot you can do to recover from peripheral neuropathy, and it doesn't have to be something that you have to suffer with unduly for a long time.
So people need to know that there's hope for all these conditions that conventional medicine may not have the answer for.
Yeah.
And when you try to wonder, what should I do first, second, or third, and how will I know which thing made the most difference? Your body doesn't work that way. Your body needs everything done at once, because you need all the parts done at once. You don't build a bridge by putting all the bolts in from one side, and then you go back at the end and put all the nuts in on the other side. You put them both together at the same time. You need all the parts to make things work. So you don't just do one thing at a time. You do everything that you know, and then you see how much change you can affect.
So get out there and build your team, and if you need some help with that, please reach out to myself, Dr. TJ Lonergan at Impact Health and Spine Centers, and
Dr. Hal Blatman, Medical Director, Blatman Health and Wellness Center, and you have a nice day.